Welcome to Branded. I'm chatting with Mark Bertolini, CEO of Oscar Health. In your business, you have one really important customer, and that's the federal government. So as CEO, how you create the conditions to take care of your customer.
I would start by our clientele are people who otherwise couldn't afford health insurance. So these are people that were largely uninsured. And in the United States, we had 42 million people back in 2010 that didn't have insurance coverage. And that was close to 12% of the US population. Today, we have less than 7% of the US population because the Affordable Care Act, passed by the Obama administration, now has 24.2 million people in one risk pool. It's now the largest insurance risk pool in the United States. And so we are able to provide low cost coverage through both a larger risk pool where you can spread risk and get lower costs, and the government subsidized people who are at certain levels of the federal poverty level. That brings more people in. And the most recent enrollment increased the overall pool to 24.2 million people. So those are the people we take care of. We do it uniquely in that we are the first platform, end-to-end health insurance platform that has been built since 1972. Everybody else uses the old one. It's called Health Edge, in their own version of it. And we are a cloud native, digitally oriented firm. So we have a lot of digital connections to all of our members. We're easier to do business with. Our brokers that sell the product, they are digitally connected. Our providers are digitally connected. We use extensively large language models and artificial intelligence to run the business more efficiently. And since I arrived in April, we've taken 1,400 basis points out of the operating infrastructure of the firm by deploying large language models. Why do we do that? How can we do that? Well, again, we're a single throughput platform, cloud native. But secondly, we have one version of the truth in our data set. And as you may well know, AI entirely relates to the data you're using to drive the insights. And so with one version of the truth, less bias as a result, we are able to produce more results with large language models and AI. All of that gives us an NPS, a net promoter score of 66 in an industry with an average of 0, which gives us an advantage of growing. So we've been growing very fast. We have grown by over 1 million members since I joined. We have higher retention because people were easier to do business with. People like what we do. And we also offer products which are counterintuitive to the insurance industry. And we offer products to diabetics. We encourage diabetics to join us. People with chronic obstructive pulmonary disease, people with asthma, because we know how to get them engaged in the healthcare system quicker and more digitally, which allows them to get better quicker.
How do you sort of reconcile? I mean, you have a startup originally, and a prominent startup that was well known. That was, in many ways, when you and I have chatted before, you said like the goal was to almost not have people with a lot of health insurance experience because, you know, we value innovation, we value disruption, we want to do things differently. Our whole reason for being in existence is doing things differently. But they bring you on, and I think you came on board, and was it 2021?
No, April of 23.
Oh, April of 20. Okay, April of 23 to bring some experience, and you're the former CEO of Aetna, and so they're doing the opposite. So how did you kind of come on board? What was that like? Was it culture shock on both sides, where we believe in, you know, disruption, and you believe in, no, this is how you run an health insurance company? How did that play out? What was your first weeks like?
So 6 years ago, they asked me to come on the board. And the reason they asked me to come on the board is that I had done a speech in 2014 to a large group of people on transformative healthcare. How do we change healthcare in the future? That they played in this company to say, this is exactly what we want to do, what this guy's saying. And so when I retired, they said, could you come on board and join our board? And I hate boards of directors. It's death by PowerPoint. It's, you know, stifling. I'm only on 2 boards now, Oscar and Verizon Communications. are the only two I have left. I got rid of most of my other board appointments. A, because I needed to be here, but B, I just found it to be stultifying to have to work on boards and do all these PowerPoints over and over and over again for hours and have people talk at you. So as a result, I said no to their board proposal. They said, well, would you meet with us every once in a while? I said, sure. So we would meet every once in a while and have a dinner and a drink, and we talk about where do we think this is going? How do we think about this? And when the stock got close to $2.50 from 39, they said, could we meet with you for an hour every week?
Okay, we need to we need to get $37 back in that price. Okay, sure.
So that's actually how they structure my comp. Get the stock back to that price, and you're a winner. And so the idea was, and they gave me some shares of the company, and we met an hour a week, and we did a deep dive. And as much as the CEO Mario and the largest shareholder Josh could talk about, we talked about the business, and I gave them some insights. Like one was the CVS contract. I said, when's the last time you negotiated that? And they said, well, we've got another year left on our 5-year contract. I said, oh my God, no, you got to do this every month. You go and talk to them about their discounts. There's money every month you can get from them. And so they started doing that.
Which, of course, you were a director of CVS before, after they acquired Aetna. So this is good advice. Yes.
And I used to negotiate with CVS before they bought Aetna because, I used to negotiate the contract. So when I first started with the firm, Ron Williams used to say to me, I need more earnings this quarter. And I used to go talk to CVS about the maximum allowable cost list and get discounts and find anywhere from 30 to $50 million every quarter. So it was like, that's the sort of thing you do. And then we talked about how the provider relationships work, how the contracts work. We just started taking apart the business. So while I was talking to them about how to think about it, I was learning about them and the firm and how they thought about it. Because I said to them, and at that time, I was working at Bridgewater with Ray Dalio. I was helping him move on, and I was chairman first, and then I was co-chief executive officer when the CEO left to run for Senate for reasons I'll never understand. Um, and and so I was just finishing bringing the new CEO along. I worked with Nir Bardea for a year and a half, and I was going to go back on the board. They said, "Hey, could you come and run the company?" And by that time, I knew enough about the company. I knew enough about them. I had the feeling because when they redid the CVS contract, that was a massive amount of money. But also, when I talked to them about fraud, waste, and abuse, which can be anywhere from 5 to 7% in the state of Florida alone, which is where almost half of our business is, and they were only getting 1%, they said, you guys got to do a better job on this stuff. They said, well, we're trying to be innovative. We want more. I said, if you can't make money to reinvest in the business, to grow it, to reinvest in our member experience, we're not going to last long. So they asked me to come on board. They offered me founder shares to fix it. And they all accrued to me when with some vesting, accrued to me every at certain price points. And I put those price points $1 more than the employees option exercise price.
So that the employees would be able to benefit as you're benefiting as
The employees won first. Yep. And then I would get paid. Because I mean, this is not about the money for me anymore. I'll be 69 in June, so it's not like I need to put more money in the bank to keep the lights on at the house or put food in the refrigerator or feed my dog. I just this was sort of um, a a passion for me in a way that the CBS deal didn't work the way I thought it could work. I wasn't there to make it work. So, I don't know exactly why it did. I have my assumptions. But when the last moment came along and I was convinced Mario was okay with it because I was going to be taking his seat, I asked the question, why are you guys in this? Why do you want to fix it? Is it just to flip it? Because if it's just to flip it, I don't want to waste my time. If it's to change the industry and really take this platform to where we think we can go, I'm your guy. And I'll build a team and we'll create succession and we'll make this company the kind of company that could put all the others to shame. And that's why I joined.
In this type of industry, I mean, are you an operations expert and you go by critical function? I mean, the same way that, Tim Cook at Apple came from operations. He knows the inner workings of his business well. Is that your sort of special sauce, your expertise? Is it operations and health insurance?
No, I know how to do operations. I know how to do it really well. I get bored by it. So my secret powers are fixing broken things and building new things. I hate making trains run on time. I can find people who can do it, but I hate making trains run on time. And because it's boring to me, I want to fix it. I want to make it better. I want to drive a Zamboni machine on the ice. I played hockey, a goalie all the way through college. I want to drive a Zamboni machine on the ice because that can't be the only pattern that works. But it's not about the pattern for the Zamboni machine. It's about the hockey game. And so you don't want me running a Zamboni machine. So I come in and I figure out what's wrong. I put together the plans to figure out how to grow them. And the very first thing we did, as soon as we had that all put in place, the first pillar of our strategy was run a great insurance company. The second pillar was create the best member experience in the industry so people want to come to us. Instead of us having to sell them, they want to buy us. They want to buy what we have. The third was extend our lines of business, which is what we're in the process of doing, so that we could help more people in the individual market. And the fourth was extend our platform to others in the industry so they can take advantage of the capabilities we've created.
What do you do to when you come on board to accomplish two things? One, make sure that your ladder is up against the right wall, and so that maybe looking at things from the outside isn't the same as being on the inside. And two, what do you do to make sure that there is buy-in from everyone else for these kind of changes? Because just you could come in here and like, Mark says this, Mark says that, and the team say, hey, we've been here longer than he doesn't understand what's going on. No, this is the way we do it. How do you get through all of that for creating change?
We're disruptors. What do we need that 68-year-old guy here for? In my first company, we ran out of money in 3 years. They brought in a guy that was the chairman of the company we had bought, one of the companies we had bought, growing it, and he was 62 years old. His name was Cal Lippett, great guy. He comes walking through the halls as acting CEO for a while. I was the head of sales and marketing. And as he walked through the hall, everybody's going, what the hell's Cal Lippett doing here? He doesn't know anything about where we're headed. He's not disruptive. He's going to do everything like he did before. And when I walked into Bridgewater and when I walked in here, it was like, I know I'm Cal Lippett. Oh my God, I'm Cal Lippett. So, so, but it's not only putting the ladder against the wall. You got to know where people are. If you would create change, having the answer and saying, this is the answer, go do it, isn't going to work. What you have to do is sit with them, hear what they have to say. How do they think about it? You ask more questions. Well, did you think about this? Did you think about that? Because most people underperform for three reasons. One, they're a sociopath and they mean harm. We can spot those people. We're pretty good at that. Number two is they don't know how to do it. And number three is they're not suited to do it. And until you can figure out those last two, you don't have any business jumping to what the answer is until you hear it. And that's why I did 10 weeks of deep dives across the organization, met everybody, heard where they were coming from, topped the list of all the things that could be fixed. It's okay, now how do we go about making this group do it? Because people coming from large organizations like me have a tendency to look for their people. They had people. I always had people. I had people around me all the time. If I thought of something, a whole organization would spring up to go look at it. At Aetna, in this company, you got to do your own work. So bringing in people that had people before often fail. You have to take a totally different view, and you have to get down at the ground level again, and you have to do the work. And that's why I was doing it for 10 weeks.
Well, and do you feel like, I mean, it's a different definition of CEO that has emerged recently that I think, usually the normal definition of sort of CEO is like you kind of like, you sort of point the organization. It's like the direction we need to head. You do it, and then lots of other people move in that direction. But you've got your singular job is to make sure that we're pointed in the right direction, or that we need to shift that. I mean, that's one definition. I sort of hear now by just to finish, and I'd love your thoughts. Elon, because of Elon Musk's style, and he's become obviously very prominent, he sort of has this alternate thing, which he's like the chief problem fixer in his companies, where he's like, he has a lot of companies. So each day a week is one company. What's the biggest problem you face this week? I'm going to solve it in this day. And he's like, a lot sort of sits with him to be this sort of fixer, as opposed to, I'm sure he has people too, but it's emanating from that. So is that a new model that is sort of unusual because no one thought that was scalable before? What is the job of the CEO?
You see, so the first person you described was George Washington standing on the bow of the boat crossing the Delaware River, right?
Okay, like in the painting, right? You're saying, okay, yes, yes.
I divide the world into two kinds. There are two kinds of CEOs. There's a Platonist and there's an Aristotelian. And the Platonist, having thought the great idea and communicated it, considers their work done. And the Aristotelian translates Plato for the masses so they can get the work done. And so I like Aristotelians. I like people who not only can see what needs to happen, but also is willing to get in and do the work to make it happen. Because that's where strategies become successful. This idea of applied science, commercialization, and scaling is where most organizations fail. And so unless you can sit there and say, okay, here's what I'm thinking, how can we imagine getting there? And what are the steps to get there? And have that conversation and then sit with the people and monitor its results and shift as you go. All the greatest companies, most of them never, what they started with was not what they ultimately became very successful for. Like the original Macs. Now it's iPads and iPhones and all these other sorts of things. So somebody had to see the vision. And Steve Jobs' vision was, I want an anthropomorphic relationship between the human and the device to be so amazing, everybody has to have one. And he did that with Johnny Ive in the beginning with the Mac, the big Macs, the original Macs, the color Macs. Open it up, found the transistors just sort of glued to the shell. He goes, why is this like this? He said, nobody's going to see it. He goes, I see it, line them up in this order, all of them. When he did his store in New York, the marble floor, 80% waste. George Blankenship, who I've worked with, who was this guy that built the Apple stores, brought 2 pieces of marble in. He goes, which one do you like, Steve? He goes, which one did I pick? He goes, no, which one do you like? He goes, which one did I pick? And finally he goes, George, can you come outside with me for a minute? I want the one I picked. He goes, but that's got 80% waste. This other one's got 20% waste. You can't tell the difference. He said, buy the F and quarry if you have to. I want that marble. So you have to have this view. You have to have this view forward that you stick to and hold to, but you have to bring people along. Otherwise, it won't happen. So Aristotelians more than nature, and that's what Elon Musk is. He gets in there and he does the work. And I do too.
You've mentioned to me before, you're 10 weeks in, you sort of listen for 10 weeks, but people get a little bit antsy. And you had a certain conversation, you have some prominent investors and founders in Oscar Health, Josh Kushner is one of them. People get antsy when you're supposed to fix what's broken here. What do you when do you know to listen and when do you know it's time to get to work when you're having those kind of conversations and investors are knocking on your door saying, hey, what's going on here?
A guy coming in from a health insurance company, which they don't like anyway, an older who's, beyond his retirement years and has made all his money. Why do I want to listen to him? What does he know? So it's in the conversation you have and in the deep dives when you're asking the questions and you see the light bulbs going on. So if it's a person who doesn't understand and you teach them something, they come back having done the work. If it's a person who's not suited to do it because they don't like working that way, they're in the wrong job. And you have to start sorting people out like that. And that's what that 10 weeks was about.
I see. So you're actually not just asking questions to get answers or perspectives, but you're trying to do this sorting process to understand who you have on the basis of that.
And how do I get it done? Because I can't do it all myself.
So this was 2023. We're at the beginning of 2025 now. Where is the business now on this journey to go? The stock price is higher. I think I saw it around 16. It probably fluctuates, but $16 a share. You got a market cap of about $4 billion. How far along are you on your journey now?
We're through in 2025. Our objective is to have so we made money in 24 for the first time. We made adjusted EBITDA in 23, which is what we told the street. But in 24, we actually made EBIT. We made real money, money you can count, right? Instead of funny money. And so that kicked it off. This next year, we've promised 2.5% margins to the street in our earnings through the year, and growth of up to 11 billion in premium. And why those two numbers matter is that 11 billion at 2.5% margins in the insurance industry generates a $5.5 billion market cap. We're at 4 point something right now, 4 point low, right? So that's one piece. At 5% margins, you get a 1x of revenue. And so by 27, what we committed to the street is we're going to have 5% margins, real margins, not EBITDA, EBIT, and we're going to have 14 billion in revenue. That makes the stock price of the company somewhere between $45 and $55 a share, depending on the PE multiple from where we are today.
You've talked about, what you've shared with the street as a public company. You have to do this, of course. But would you run it any differently if this was a privately held company? Would it be the same, or what's the difference?
When you're running a public company, you have to show a progression. You have to show growth and the right metrics that lead to the ultimate number. In a privately held company, you may hold back on not the earnings part, but on some of the other things, so you can make the right investments to get there quicker. So sometimes taking it private, which some companies do, is a way to really sort of get things accelerated internally so that you come out with a stronger set of numbers or the same set of numbers earlier.
You're saying, if I'm going to paraphrase here, but correct me if I'm wrong, but like a lot of what public markets do is they value trust. And trust is based on you say what you're going to do and then you do it. So they don't want to be surprised by, we got this great opportunity and we're just jumping in head first. Whoa, you didn't tell me about that last quarterly call. Where'd this come from? How come I'm surprised? I don't like that. So you're saying that creates a different dynamic.
When I took over as CEO at Aetna, we were at $29.85 a share. When I left Aetna, we were $208 a share. Of that 652% total shareholder return, only 1/3 of it was EPS. 2/3 of it was the price earnings multiple, which is the street's belief in the credibility of management to consistently deliver revenue and a profit that people want in the way of a product going forward. That's what that PE is.
So you're saying, trust is actually measured. Trust is measured in the price to earnings ratio that you experience. And if you're trusted, you're going to be more valuable relative to your earnings.
And in all those quarters, I underpromised and over-delivered every time and never committed more than 7% earnings growth in any given year and delivered 17 consistently every year.
Overlooked skill in all of that is not just doing what you need to do to be successful, but also saying what you're going to do in a way that builds trust. And you're talking about doing that gradually. Like, just being great results is great, but saying that you're going to deliver great results and then delivering is a huge trust builder. In
my first 2 months at Aetna as CEO, the first meeting I walked into was a whole bunch of hedge funds in the room. I stood at the head of the table. I said, either you people think I'm either lying or I'm stupid, neither of which endears me to you. See ya. I'm not talking to you again. And I walked out of the room. You get the shareholders you deserve. And then 3 weeks later, I'm meeting with our top investors, and our largest investor, 34 million shares in Aetna, said to me, you need to double your dividend or double your stock buybacks. I said, actually, I'm cutting my stock buyback in half, and I'm not going to increase the dividend. They said, well, what if your largest investor insists on you doing it? I said, then my largest investor should get the hell out of my stock. I don't want you. I'm going to invest in the business and I'm going to grow it. They got out at $39 and got back into the 109. And when they got back into the 109, they said, whoops, we made a mistake. Yeah, you did. So when people complain about what my shareholders want, you can change your shareholders. You just have to be honest with them.
So what do people in healthcare, health insurance industry, what do they miss right now that you think they would be wise to pay attention to about where this is all headed? What do you think is just generally undervalued or overlooked in the industry?
Because the industry has such a small margin, right? It's anywhere from 5 to 7%, depending on the product type. We manage thousands of little metrics every day to make sure we hit our medical cost targets. Because when you miss your medical cost targets, your medical loss ratio, the street punishes you endlessly. And we do a lot of stupid things across a large organization, like prior authorizations, that sometimes may seem good over here in medical costs, but are really bad for your customer service. And unless you look at the whole thing and you have to have one anchor point, who's my customer? It's the member. How do we make sure we know we're doing the right things? It should, whatever we do in the way of investment in the firm needs to enhance the member experience every time we do it, or we have to ask ourselves why we're making the investment. That's what we think here at Oscar. And that's why we have an NPS of 66. And when you don't do that and you have a bunch of people picking at different parts of the P&L trying to make their numbers, quote unquote, you get a miasma that results in bad stuff, like the shooting of a CEO.
Which I wanted to actually ask you about, because you have a unique vantage point to, I mean, not only a horrific act in the industry, but just the reaction was kind of people in general, and some people, taking their frustration out on maybe how a system has treated them, and what was your perspective on all of that, seeing that and seeing the reaction of sometimes people supporting, essentially, an act of murder.
I'm not surprised by the anger and the frustration. I'm not. Everybody I know, including me, when I access the system because of my neck injury and everything I had, including me, I have stories to tell. And that's why the system is broken. But because we deal with 6,500 hospitals and 760,000 providers and 1,300 insurance companies and X pharma and Y device manufacturers, all with different revenue models and different economic models, like doctors work on a cash basis. Hospitals work on a revenue basis. As long as my revenue grows, I can afford more stuff. Insurance companies, biomedical, pharma, they all work on a margin basis. Throw all those economic models together and you got yourself a mess. There's no alignment. And so what do? You try to either consolidate, which we now see not working. When you see the PBMs at the large insurance companies, you need to really start to focus on who the customer is. And so I think every American should have access to an individual policy where I can buy my network, my product that works for me and my family. But when you work for an employer, they pick something on the average employee. There are no average employees. They pick the coverage, what's covered on the basis of average employees, not for the people who really need good coverage on either end of the spectrum in different ways. And so what we have to do is create an individual market. And that's why I think the ACA market with 24.2 million people and a 3.5% trend for the last 4 years actually is the place to do it. I remember 20 years ago, we said we will reach nirvana in healthcare reform when healthcare cost inflation rises at the rate of CPI. That's what's been happening in the ACA for the last 4 years.
You mean the consumer price index, that just the cost of good, it's increasing at the same rate, not in any particular higher rate, just everything's rising.
3.5% for the last 4 years in the ACA. And the reason is that because when you're developing an individual product, you can do narrow networks. And as long as everybody's in the market with their own narrow networks, I as an individual can buy the network I want, not the one my employer bought for me, which is usually a wide area network, which has less cost advantage to it because everybody's in. Instead of people having a narrow network where you get better pricing and you get better premiums.
I see. So you're saying that better to have like a lot of smaller niche specialties, but a lot of them to empower choice, than one mammoth thing that sort of is suitable for no one but the average person that doesn't really have a lot of specialized needs.
That's why I think, with ICRA, the individual consumer health reimbursement account, can work for the gig economy, 30 million people, can work for small group and middle market employers. Small group employers have seen double-digit rate increases. Wouldn't they love to have 3.5% in the ACI? and build a product that's defined contribution. They give the money to the employees. The employee buys the product they want with the network they want. And actually, in most cases, because in small group, most employees are overinsured for the sick people in the group because it's a level premium plan. I can actually have money left over after I buy my policy that works for me. I can use that for deductibles or copays, or I can buy vision, or I can buy dental, or I can buy life insurance. I can do more with my benefits. And when I buy at that level, the employer has a more stable defined contribution amount over time because they're not paying the same rate for everybody.
All of this, and there's been many plans over the years. It sort of sounds good, but lots of other factors get in the way. Notably, one, it gets caught in political dynamics. And what do you think about, and what is your perspective on? Because I mean, there's a lot of course, ACA was from President Obama. President Trump kept it. He said it was imperfect. He doesn't like it, but begrudgingly, it's there.
He passed ICRA though. Donald Trump passed ICRA. So think about this. The Dems, when they did the ACA, wanted to make everybody buy healthcare from the government on an individual basis. That was the long-term plan. Let's put the insurance companies out of business. Let's create a strike price, an MLR, a minimum MLR, so they can't make too much money sooner or later. They're all going to go away. And when they didn't all go away in 2014 and 2015, because they'd figure out how to be in that market, everybody went, okay, it didn't work. Then along comes Donald Trump. And Donald Trump says, I don't like this product, but I want a competitive market with accessibility and more access and more choice. I want people to have choice. So he creates ICRA. 63% of all the people in the ACA today come from red states. It's his constituency. So when you look at that dynamic, you have to say he can't kill it with 24 million people in it. He has to make it better. But wouldn't it be genius if the Democrats and the Republicans said, let's create an individual market for every American? That's what the Democrats wanted in the beginning. That's what we can do with a competitive product in the ACA today. Let's move forward. That's the story I have for them. Let's do this. This is the moment where we can actually get both parties agreeing to do something that will work for every American.
And how much of your effort has to be because the federal government is your big and sole customer, that you have to be engaged, you have to make sure, because there is risk, there is existential risk to your business if there was a dramatic change in what the federal government does. How keyed in are you?
I mean, so when the ACA was passed, Ron Williams handed me the keys to the company and said, okay, you're running it now, get ready. And so I had 1,900 people sitting in a room implementing 12,650 pages of regulations to be in the ACA. In another room, I had 300 people. I said, find me the pony in this horse shit. There's got to be a pony. And we did. And so the idea is never waste a crisis. Find the way through. Don't fight today's fight. Look at the longer run and say, how can we win that game? And so I tell our employees here, Oscar is a pirate ship filled with cannons among Spanish galleons filled with gold. All we have to do is take their business from them. Let's take middle market and small group, 6% margins, away from them with ICRA. Let's go after Medicare Advantage by empowering health systems to be in the Medicare Advantage business at 4% margins versus 7% in the insurance industry. And let's change it for all Americans. Let's get people that are in the 100 to 139% of Medicare with subsidies into the ACA, where they have more choice of a product and a better network. Let's make it better for everybody. And let's put it behind us and say we don't have to deal with that crap anymore.
And what is your advice for any other CEOs or leaders on just dealing with entrenched industries that are built a certain way over time that are very hard to change? What is your more general advice beyond healthcare?
I mean, if you ever watch water against stone, eventually the stone comes down over time, disappears. And so, it depends on what your level of patience is and finding the cracks and the places where you can exploit the opportunity in a way for the betterment of everybody else. This is one of those moments for the healthcare industry. Nobody's happy with what's going on. The providers hate it. The big insurance companies are getting beat up over their PBMs and their Medicare Advantage for profits. Middle market employers are lost in the middle. They're the only group left of insured population, of truly insured group population, is the middle market and small group, 50 to 1,000. And so as you look at all that, all these people are unhappy with rate increases or what the government wants to do to regulate them. Let's stop all the madness and create an individual market where we separate the investment from the financing decision. So being from Detroit, if I walked into a dealership and I said, I have $350 a month for a car, guess what would happen? I get a lousy car. I get a bad deal. But if I say instead, I want this kind of car, I want 4 doors, I want it to be able to travel this far, whatever it may be, and then you say, how much does that cost? Then let's finance it as cheaply as possible. That's the way health insurance should work. Let's understand what we need to do for people, what product they want. Let's find the cheapest way to finance it. Instead of the other way around, we hand them a warranty card. Here's your ID card. When you get broken, you go get it fixed. Go to one of these providers. We've got the investment and the financing decision conflated in healthcare, and it just doesn't work. So if you turn to people who buy the healthcare, turn to the people who are angry at the healthcare industry and say to them, what do you want? Let us offer the opportunities for you to pick. You choose. Your employer or the government will give you the subsidy to go do it. The choice is mine. I remember Brian Monahan at Bank of America. They were the last people to do online check deposits. I said, "Oh, why did it take you guys so long?" Says Mark, we were afraid of people making mistakes and blaming it on us. And what we found out after we tried it is when they made mistakes, they blamed themselves. They owned it. So let's let Americans own their healthcare. That's and so in any industry, you have to look for that opportunity that says, where are the opposing parties? And this is what I'm telling a lot of my friends now, my CEO friends now, is stop reacting to everything the Trump administration does today. That's noise. Look at where it's all headed and fight the fight where you need to fight it, but not every inch. You'll exhaust yourself. You'll get confused. Flight, fight, or freeze is what happens when your anxiety's high enough. Don't let that happen to you. Look ahead. And so I think, a lot of people haven't looked far enough ahead. And quite frankly, with CEO average tenure about, 3 to 4 years, nobody wants to. I had a friend who left as a CEO after 4 years and said, the only thing I can say is I'm glad I didn't screw it up while I was in charge. It's like, wow, what a legacy.
And final question for you is, what is your perspective on just you describe it yourself as you were retired, you weren't playing, you're reducing your board activity, focusing on I know kind of like dogs is one of your passions as well. What is your perspective of just the balance between sort of experience, wisdom, know-how? I'm sure you're in a ton of meetings too with young up and comers who think they know everything. Maybe they've been very successful in some right. Maybe they don't. The experience is not typically one of the things valued as well. What is your advice for just balancing all of that, making companies perform well, and for people on either side? You're the young up and comer, or you're the person that has a lot of wealth of experience. What is your advice in just balancing all of that to get great outcomes?
There are 2 things I look for in every executive that I evaluate. I call them the 2 C's: curiosity and courage. If you're endlessly curious, you learn every day. And the heuristic in your head about how the world works grows. It gets more complete. I remember sitting next to Bill Taylor, who was the chairman of Cigna, at a bar one night. We're having a drink, and I go, how will I ever know all the people you know and all the things you know? He goes, Mark, you just have to keep going. It'll get there. And now I know those things. And so it's all through experience. So I spent 2 nights a week until about 20 years ago. I spent 2 nights a week meeting with somebody for dinner or drinks I didn't know because I just wanted to learn. And as a result, I've never really interviewed for a job. The phone has rang and people have said, can you help me? Now, the other side is you have to know yourself. I fix broken things and build new things. So don't get into a job making the trains run on time. I'll screw it up. I'll get bored with it. I'll break it. I'll tinker with it when it doesn't need to be tinkered. So having awareness of its oneself and a network where you're connected and you can continue to learn allows you to keep going. I often get the question of work-life balance, and so I always refer people to the end of the movie Tombstone. And Wyatt Earp goes to see Doc Holliday in a sanitarium in Colorado. He's dying of consumption. It was TB. And he's laying there in bed with his boots off, and they start to play cards. And Doc Holliday says, I don't want to play cards anymore, Wyatt. I'm going to die. I just want to die. And he goes, but Wyatt, what do you want out of life? And Wyatt Earp was a bad man, a gambler, a lawman. He did all these things. Miner. He goes, I just want a normal life. Doc Holliday said one of the most important things I say to everybody, there is no such thing as a normal life. It is all life. And so you know when you need to be where you need to be, when you need to be there. When my son got diagnosed on December 1st of 2002 with cancer, I was with him. I quit my job. That was the most important place for me to be. And so people often struggle, well, how should I spend my time? You'll know. If you're curious and you're courageous, you'll know the next action you're supposed to take. So I still work because I'm going to die with my boots on. I'm endlessly curious. I want to learn more things. I want to meet people that are smart. I want them to help me be brighter. When I became CEO at Aetna, I was told, call 40 people that informed you as a leader, good and bad. And I did that. Called them all. And 39 people, when I asked them the question, what should I do to repay you? They said, pay it forward, which is what I do. So I'm doing this. And the person who said, didn't say pay it forward, was the person who taught me the worst possible things I could ever learn as a leader. I wanted to run from that guy, but I learned so much watching him work and watching him get fired. And he said to me, Mark, I need a job. I said, absolutely not. I cannot do that. I won't use his name. I said, but X, no, I would never hire you.
What was the bad advice? What was the worst advice you ever got in your career and on this journey? What was the negative role model?
My dad told me, your memory is too short to lie. Always tell the truth, whether it hurts or not. Your memory's too short, and somebody's going to catch you one time, and it's going to be so embarrassing. It's going to cost you all your credibility. So people know that when I say I'm going to do something, I do it. They know when I believe something, I'm believing it. And if I knock on wood, nobody's ever called me out for my integrity. I tell people this, of all the things you have, your home, your family, your possessions, your intelligence, all of that can be taken away from you. It can all be taken away. There's only one thing you have to give up that can't be taken from you. Only you can do that, and it's your integrity. Only you give that away. It's a major fatal flaw. For me, I catch somebody in lies. It's like, I'm done with you. There's no reason to do that.
Well, Mark Bertolini, I could talk to you all day. Fascinating guy. Insights on healthcare industry, healthcare insurance, but also insights on life and business success and the nature of experience and wisdom. Thank you for joining us on Branded. Mark Bertolini, CEO, Oscar Health, and best wishes for continued success.
Thank you, Ben. Great to see you.